Good afternoon. Praise be Jesus and Mary. Today, I am going to discuss Activity 1 with the title Course Orientation on your Virtual Clinical Pharmacy Internship Manual. Let's start with the objectives. At the end of the activity, students are expected to realize the importance of professionalism in pharmacy, describe ACCP clinical pharmacy functions, identify the clinical pharmacy functions and services. Okay, what is professionalism? Why it is important? Let's first define professionalism. According to Merriam-Webster's definition on professionalism, professionalism as a set of attitudes and behaviors believed to be appropriate to a particular occupation. The ACCP described professionalism as the active demonstration of the traits of a professional. Professionalism comprised of attitudes and behaviors. So when you say attitudes, it often described and measured because of the relationship to behavior. So what are professional attitudes? These are feelings, emotions, or thought that upholds the ideas of a profession. And also, it serves as the basis for professional behavior. Professionalism refers to the standards, behaviors, and characters of an individual engaged in tasks related to his or her work or profession. Healthcare professionals generally place the needs of others before their own. So it is essential that student pharmacists learn what it means to act professionally and that they foster professionalism and demonstrate its importance from first day of pharmacy school and all throughout their career. As a professionals, pharmacists have a certain responsibility to society, and it is crucial to maintain behaviors and attitudes worthy of the respect the public has for the pharmacy profession. There are qualities noted as exemplifying professionalism. So what are those qualities? First, we have altruism. So when you say altruism, serving the best interest of the patient, even above the needs of the pharmacist or the employer. Accountability. Accountability, that is honoring the oath taken to serve the patient and the public. Another quality is excellence. Being a lifelong learner to serve patients in the best possible manner using the most up-to-date information. Duty and responsibility, that is serving the patient to meet his or her needs even when it is not convenient. Another quality is honor and integrity. Being truthful and honest. Ensuring the patient is never compromised by a conflict of interest. Then we also have a quality of respect for others. That is maintaining respect not only for patients but also for co-workers, colleagues, or other healthcare professionals with whom one may interact. So these are examples of and exemplifying qualities of a professionalism. Professionalism is a complex concept that draws on personal motivations as well as a professional skills. This slide represents a professional pyramid. It offers one approach to develop and build on the specific skills that are representative of the concept of professionalism. So let's start at the base of the pyramid. The base of the pyramid on the right side is competence or professional capability or professional expertise. This domain, which represents pharmacy knowledge learned as well as the ability to be a self-directed learner, serves as the basis for all other professional activity as a pharmacist. Competence, your professional expertise. Next domain is connection or interpersonal compatibility. Interpersonal compatibility. So in this domain, professionals relate to their patients using empathy, kindness, and effective or good communication towards your clients or your patient. That is interpersonal skills. The highest level of professionalism is represented by character domain, character or personal reliability. This domain, which includes the qualities of integrity, responsibility, and moral courage. Professionalism, what is professionalism and trust? So when you say professionalism and trust, so pharmaceutical care practitioners or healthcare practitioners must develop a trustworthiness to its patient. Patients must know that they can seek the confidential advice and assistance of their pharmacist and that their wishes will be carried out. Another is positive first impression. Professionalism is determined by the way we look and we act, and even personal hygiene and presentations. These are fundamentals of professionalism. Did you know it takes as little as 3 seconds to form a first opinion of someone? And just a tenth of a second of exposure to face leads to the development of a first impression. So I have here examples of a positive first impressions. So you have to be punctual on work, your work. So if, for example, if your shift or your duty calls you for a 7 to 3, 7 to 3, of course, you have to be on time, or it is best if you can be 15 minutes ahead of your scheduled time. Be confident when you face with your colleagues and with your patient. Make eye contact when you do counseling and even when you talk to other healthcare practitioners, and greet with a firm handshake. Handshakes are also one of the most important first impression one makes. However, with the current situation that we have right now, that we're facing right now, of course, you have to avoid handshaking. That is to prevent, of course, transmission of viruses. So you can greet your patient, say, "Good morning, ma'am. Good morning, sir." Then, of course, always have an eye contact with them. Then open the conversation. Use small talk like, kumusta na po? Diba? That's a good or a positive impression. Be optimistic. Aside from that, grooming, appropriate grooming, and hygiene form an important part in maintaining an image, in maintaining an impression, a positive impression. So, grooming and hygiene delivers competence as a healthcare practitioner. Next is professional behavior. Behaving in a manner to achieve optimal outcomes in professional task and interaction. So the key clinical concept here is caring for others is a privilege that is reserved for those individuals who are uniquely well equipped, well prepared, and who adhere to standards for professional behaviors. All healthcare professionals are expected to learn and execute a set of behavior that set them apart because they are working with the patients. They work with the patients, they make decisions that can have a significant consequence to the patient. The behavior and standards expected are described as the standards for professional behavior. So this slide will present you a table on the standards of professional performance for pharmaceutical care practitioners. We have the category, standards, and measurement criteria. So under category, we have quality of care, ethics, collegiality, collaboration, research, education, and research allocation. With this category, they have different standards and different measurement criteria. So let's start with quality of care. So the standard of quality of care, the practitioner usually evaluates his or her own practice in relation to professional practice standards and relevant statutes and regulations. For this criteria, or pharmaceutical care practitioner uses evidence from the literature to evaluate performance in practice. 6. Peer review on a continual and frequent basis. Utilizes data generated from practice to critically evaluate performance. Another is on ethics. The practitioner's decisions and actions on behalf of patients are determined in an ethical manner. So what are the criteria under this category? The practitioner maintains patient confidentiality. Practitioner also acts as a patient advocate. He or she delivers care in a non-judgmental and non-discriminatory manner that is sensitive to patient diversity or cultural diversity of the patient. Delivers care in a manner that preserves, protects patient autonomy, dignity, and rights, and also seeks available resources to help formulate ethical decisions. Another category is the collegiality. So pharmaceutical care practitioners contributes to the professional development of peers, colleagues, students, and others by offering assistance to other practitioners whenever asked, or supports positive relationships with patients, physicians, nurses, and other healthcare providers. Collaboration. The practitioner collaborates with the patient, family, and their caregivers and healthcare providers in providing patient care. So the patient is seen as the ultimate decision maker, and the practitioner, the healthcare practitioner, collaborates accordingly. The practitioner collaborates with the patient's healthcare providers whenever it is in the best interest of the patient. Next is on the category of research. The practitioner routinely uses research findings in practice and contributes to research findings when appropriate. So they uses research results as the basis for practice. Pharmaceutical care practitioner systematically reviews the literature to identify knowledge, skills, techniques, and products that are helpful in practice and implements them in a timely manner. Practitioner also approaches practice with a perspective to conduct applied research in practice when appropriate. So usually the practitioner uses an evidence-based before they would conclude that it is effective or safe for use based on different or several clinical trials. Especially ngayon na ang daming naglalabasan na possible treatment for coronavirus. The first issue was on hydrochloroquine, an anti-malarial drug, di ba? Um, says na it can treat coronavirus disease. Pero, of course, you also have to research on the side effect of the drug to patients. So, ang daming dapat i-consider before you conclude na, ay, tama, pwede to siya na gamot or it's the best drug for this treatment. You have to undergo several clinical trials. You have to undergo researches, different studies from different countries. Yan yung dapat it should be evidence-based. Next is education, category on education. The practitioner acquires and maintains current knowledge in pharmacology, pharmacotherapy, and pharmaceutical care practice. The practitioner uses the skills of reflecting on practice to identify areas where knowledge needs to be supplemented. Practitioner continually updates knowledge with journal subscription, current text, practitioner interactions, and continuing education program. So the best way to keep updated with the trends, with the current trends of our profession is to undergo continuing education program. Aside from that, of course, you can read journals, journal subscription, or you can attend webinars on current issues about, of course, the very issue natin ngayon is on COVID-19, di ba? And talking to clinical practitioners or talking to your physicians. So the best venue for interactions with other healthcare practitioners is through experience or this internship. Kasi you can really talk to the physicians with regards to treatment goals of a certain patient. Or you can suggest, then it's a good conversation. Next is resource allocation. So the practitioner considers factors related to effectiveness, safety, and cost in planning and delivering patient care. So criteria for this, so pharmaceutical care practitioner is sensitive to the financial needs and resource limitations of the patient, the healthcare providers, and the institution. So you have to know how to allocate resources, finances of the patient. Decisions are made by the pharmaceutical care practitioner to conserve resources and maximize the values of those resources consumed in practice. Communication. So when you say communication, it could either be patient-focused communication or practitioner-focused communication. So when you say patient-focused communication, it is a communication with patients that brings together many of the dimensions of pharmaceutical care. So the nature and ethical framework of the relationship is at the center of communication. At the center of the communication is the relationship between the patient and the clinical practitioner. So the key to building a therapeutic relationship as well as successfully communicating with patient is to create an environment for the patient that has the right conditions for fostering good communication. This includes your empathy and your positive regard to your patient. So empathy, that is, you communicate to the patients the feeling of being understood, or you are putting yourself in the patient's situation. Parang i-feel nyo talaga na nakikiramay kayo. Empathy. Positive regard, by communicating support to the patient in a caring and non-judgmental way. Communicating involves the honest expression of the practitioner's own thoughts and feelings. So as a pharmaceutical care practitioner, there are three primary objectives to communicate with the patient. Communication with the patient. First is to get information, necessary information from the patient to make your decisions. Patient history, medical history, all the information na kailangan. Important information. To negotiate the terms of the goals of therapy and the patient's role in achieving them. Diba? It is a two-way process. It involves the patient and the clinician, or the pharmaceutical care practitioner. So when it comes to decision making, especially on therapeutic goals, you have to involve the patient. Hindi pwede na kayo lang, you as a clinical pharmacist would be would be involved in the decision, or with the other doctors, or kayo lang healthcare professionals. It should be with the presence of the patient. And also educate the patient about drug therapy she or he is receiving or taking. Another is practitioner-focused communication. So practitioner, that is your colleagues or co-workers. Practitioners use a specific practice vocabulary, and it should be employed when communicating with other healthcare practitioners, whether verbally or in writing. So your purpose for communicating with colleagues usually involves patient care. You may be asking for help with the care of a patient, or sharing the care of a patient with a coworker or a other healthcare professionals, or sharing your knowledge with generally or sharing your knowledge more generally with colleagues or other healthcare professionals. Of course, this requires an effective communication. Diba? It is also important that you have to be precise when discussing a patient's care. Precise and be concise when you talk with other healthcare professionals, because neither you nor your colleagues has time to waste. So wala nang paligoy-ligoy pa. Wala nang mataas yung introduction. And of course, you have to be complete. Complete yung or detailed yung communication. Because anything not mentioned is assured to be normal, and this could be a significant misunderstanding. Diba? Confidentiality. The duty to protect patient confidentiality, usually it emerges from a relationship based upon trust. The trust that is built between practitioner and patient is compromised without the assurance of confidentiality. Yan siya. As a clinicians with clearly defined pharmaceutical care responsibilities, have a duty to protect a patient's personal information from public view. Hindi pwede na you're given the information by the patient kasi yung patient trusted you on his or her disease. Hindi pwede na ipagsigawan mo or ilagay mo sa social media yung kanyang history. So you have to protect that patient. Kasi sa kanila, they trusted you on their confidentiality, on their private information. The patient-centered approach to pharmaceutical care and the ethical principles involved in patient care all lead to a set of standards for professional performance. Although the standards are quite self-evident, their statement in an explicit and complete manner is necessary to finish the subject of practitioner responsibilities within the philosophy of practice. Next is on cultural diversity. We all know that pharmacists are carrying more individuals of diverse religious beliefs or religion, different age group, gender, socioeconomic status, mayaman, mahirap, or in the middle class. Race, ethnicity, sexual orientation, and even health beliefs. Yan yung pinagsisilbihan. Different talaga yung pinagsisilbihan ng pharmacist. Multi or diverse, biodiverse. Culture is a dynamic process with people moving in and out of various cultures throughout their lives. So failure to understand and respect individuals and their culture or cultures could impede pharmaceutical care. Incongruent beliefs and expectations between the patient and the pharmacist could also lead to misunderstandings, confusion, and ultimately to drug misadventures. So it is important to take a patient-centered approach when providing care to patients. Another example for cultural diversity, the inability to explain a prescription in the patient's language. So if you cannot explain to patient uh, to patient yung prescription, it can lead to poor adherence of the medication, or could lead to lack of effect, or could also lead to toxicities, di ba? Or if a patient identifies the best treatment for an illness is based on herbal product, prayer, shaman. So the pharmacist must be prepared to accommodate these cultural practices by integrating this practice into a treatment plan, or acknowledging acceptance, or combined traditional and alternative therapies, diba? Or if a patient who believes that the source of her illness is spiritual, might be less likely to adhere to a drug treatment plan that does not acknowledge or incorporate her spiritual traditions. Development of cultural competence in pharmacy practices has the potential to increase effectiveness of drug therapy and favorably affect health outcomes. So take note that healthcare providers and students must also understand that they belong to a professional culture, a culture of biomedicine. So very diverse talaga. Yan ano natin. So pharmacists need to gain an understanding of patients' health beliefs when communicating with them about their health and medications. Sexual harassment and discrimination. What does it mean? So when you say harassment, harassment can be a single incident or a pattern of behavior where the purpose or effect, either intentional or unintentional, creates an intimidating, hostile, or offensive environment, unreasonably interferes with an individual's participation in work. Harassment can take many forms. Harassing behaviors could include unwelcome verbal or written comments, unwanted physical contacts, jokes, negative stereotyping, written or photographic materials that make fun of or insult an individual or group, threatening or intimidating body language, gestures, or acts, or other similar inappropriate remarks or behavior. So those are different forms of harassment. When you say sexual harassment, it is a form of unlawful, prohibited discrimination. It involves individuals of the same or different gender. So it can include unwelcome sexual advances or request for sexual favors. Yan siya. Pharmacies deal with a lot of different types of discrimination, especially since the job or this job role usually is open to a diverse group of people. Male pharmacists and female pharmacists have faced employment discrimination for age, race, gender, and disability. An example um, of age discrimination. A pharmacist, a 65 years old pharmacist, took a vacation to celebrate his 65th birthday at the beach. And when he came home, he discovered that the pharmacy he's working had fired him and replaced him with a 27-year-old pharmacist. So although the pharmacy claimed that he was fired because of work performance issue. But of course, the pharmacist shared that the supervisor called him an old man. So, so the what happened here is that, of course, they bring it to court, and that pharmacist won against this lawsuit. Code of ethics for pharmacists and oath of pharmacists. Pharmacists are health professionals who assist individuals in making the best use of medications. So this code, prepared and supported by pharmacists, is intended to state publicly the principles that form the fundamental basis of the roles and responsibilities of pharmacists. These principles, based on moral obligations and virtues, are established to guide pharmacists in relationship with patients, health professionals, and society. So what are these code of ethics for pharmacists? First, a pharmacist respects the covenantal relationship between the patient and pharmacist. Considering the patient-pharmacist relationship as a covenant means that a pharmacist has moral obligations in response to the gift of trust received from society. In return for this gift, a pharmacist promises to help individuals achieve optimum benefit from their medication, to be committed to their welfare, and to maintain their trust. So they have to respect that covenantal relationship between a patient and a pharmacist. Pharmacists are given this gift of trust. So they have to keep that trust. A pharmacist promotes the good of every patient in a caring, compassionate, and confidential manner. A pharmacist places concern for the well-being of the patient at the center of professional practice. In doing so, a pharmacist considers needs stated by the patient as well as those defined by health science. A pharmacist is dedicated to protect the dignity of the patient with a caring attitude and a compassionate spirit. A pharmacist focuses on serving the patient in a private and confidential manner. A pharmacist promotes the right of self-determination and recognizes individual self-worth by encouraging patients to participate in decisions about their health. A pharmacist communicates with patients in terms that are understandable to patient. In all cases, a pharmacist respects personal and cultural differences among patients. A pharmacist has a duty to tell the truth and to act with conviction of conscience. A pharmacist avoids discriminatory practices, behavior, or work conditions that impair professional judgment, and actions that compromise dedication to the best interest of patients. A pharmacist has a duty to maintain knowledge and abilities as new medications, devices, and technologies become available and as health information advances. When appropriate, a pharmacist asks for the consultation of colleagues or other health professionals or refers the patient. A pharmacist acknowledges their colleagues and other health professionals may differ in the beliefs and values they apply to the care of the patient. They respect values and abilities of colleagues. The primary obligation of a pharmacist is to individual patients. However, the obligations of a pharmacist may at times extend beyond the individual to the community and society. In these situations, the pharmacist recognizes the responsibilities that accompany these obligations and acts accordingly. When health resources are allocated, a pharmacist is fair and equitable, balancing the needs of patients and society. Equal distribution of health resources. This slide presents the oath of a pharmacist. I think I will not be reading this one anymore. Ethical considerations in practice. What are the ethical considerations in practice? We all know that pharmacists are an essential part of the healthcare multidisciplinary team. They help to ensure that medicines are used in the safest and most effective manner. The ethical responsibilities of a pharmacist that relate to the community includes you have to maintain the reputation and trust that the public has placed on the profession. And of course, refrain from abusing this trust and respect. Acknowledge their place in the wider community, including their professional role and responsibilities to control and supply pharmaceutical goods for optimal health outcome. Another ethical responsibilities of a pharmacist that relate to the profession is the commitment or to commit to the development and enhancement of the profession by involved by becoming involved in activities such as training staff, teaching, being a preceptor or mentor for students, interns, or colleagues, participating in initiatives to develop the profession and demonstrate positive leadership. Ethical responsibilities of a pharmacist that relate to other healthcare professional. Of course, you have to keep up to date with knowledge of pharmacy practice, with lifelong learning and self-development to maintain professional competence and personal health to continue practicing. Practice only when their professional independence, judgment, and integrity remains upheld, and manage situations with a conflict of interest appropriately. With other healthcare professionals, of course, you have to work in cooperation and collaboration with other healthcare professionals to achieve the optimal health outcomes for consumers. What is professional experiential education? In other terms, this is an internship, an on-the-job training. Experiential education should be utilized throughout all years of the pharmacy curriculum, typically culminating in the last professional year. Experiential education is defined as a methodology. It is a methodology in which educators engage learners in direct experience and targeted reflection in order to increase knowledge and to develop skills, behaviors, and values of future pharmacists or of students. It is an ideal training medium for application and reinforcement of information learned through didactic coursework. So this form of active learning targets adult learning styles and learn, promotes learner-centered and lifelong learning. So specifically, it talks on experiential, um, direct experience and with the patient, or that is what we call internship. So there are two forms of professional experiential education: the introductory and then the advanced. The introductory pharmacy practice experiences, these are essential for students in the professional curriculum to acquire an overview of pharmacy practice and its role and responsibility in healthcare. Mock or case-based scenarios may play a limited role in introductory training, but not a substitute for hands-on practice experience. So there is a still a direct involvement of the students, hands-on talaga. IPPE, or the Introductory Pharmacy Practice Experiences, should begin early, ideally during the first professional year, and should involve actual practice experiences and service activities, focusing on proficiency in meeting core competencies that are clearly articulated. In our settings of Philippines, we usually do our internship after we had finished all the academic subjects, diba? But then, if it is in other countries, they are already practicing na from the first professional year. The students are already involved in actual practices. They have to enroll in actual practices. And usually IPPE constitute 5% of the curriculum. IPEE, of course, this serves as the foundation for professional growth and advanced pharmacy practice experience. So there is a direct involvement of students in patient care activities at all stages. So it is essential for reinforcement of didactic coursework early in the curriculum and enhancement of student motivation and learning skills. The APE, or the Advanced Pharmaceutical Practice Experience, ideal for development of fundamental skills and attitudes such as professionalism, communication with patients and healthcare professionals, and even problem solving. Patient counseling could be done in the advance. They are already well equipped to handle patients and starting to develop professionalisms and a good communication skills with the patients and other healthcare professionals. The clinical pharmacy functions in services. We all know that clinical pharmacy practice in healthcare settings where they have frequent and regular interactions with physicians and other healthcare professionals contributes to better coordination of care. So clinical pharmacists, they work directly with physicians, other healthcare professionals, and patients to ensure that the medications prescribed for patients contribute to the best possible health outcomes. Clinical pharmacists are frequently granted patient care privileges by collaborating physicians and or other health systems that allow them to perform a full range of medication decision-making functions as part of the patient's healthcare team. These privileges are granted on the basis of the clinical pharmacist who demonstrate knowledge of medication therapy, and record of clinical experience. Another function, assess the status of the patient's health problems and determine whether the prescribed medications are optimally meeting the patient's needs and goals of care. Evaluation on the appropriateness and effectiveness of the patient's medications. Recognize untreated health problems that could be improved or resolved with appropriate medication therapy, and follow the patient's progress to determine the effects of the patient's medication on his or her health. Consult with the patient's physicians and other healthcare providers in selecting the medication therapy that best meets the patient's needs and contribute effectively to the overall therapy goals. So these are some functions and services of a clinical pharmacy. Advise the patients on how to best take his or her medication and support other healthcare teams' effort to educate the patient on other important steps to improve or maintain health, such as exercise, diet, and some preventive steps like immunization, and refer the patient to his or her physician or other health professionals to address specific health, wellness, or social services concerns as they arise. So specific functions of clinical pharmacy services. Patient assessment. So patient assessment includes, of course, physical assessment, barriers to adherence, and the psychosocial issues. These are patient assessment. They have to involve on or to involve in physical assessment and psychosocial issues. Patient education and counseling. So the clinical pharmacist must have skills on how to interview the patient. Communication skills like empathy, listening, speaking, or writing at the patient's level of understanding. Ability to motivate or to inspire the patient. Develop and implement a patient education plan based on an initial education assessment. And also, identification and resolution of compliance barriers. Another function is patient-specific pharmacist care plan. Recognition, prevention, and management of drug interactions, pharmacology and therapeutic, innovative and conventional ways, interpretation of laboratory tests, knowledge of community resources and professional referrals, communication and rapport with community medical providers. Drug treatment protocols. Develop and maintain protocols, must be updated. Follow protocols as a pharmacist clinicians. Monitor, aggregate adherence to treatment protocols like drug use evaluations, especially for a managed care or healthcare facility. Dosage adjustment, identify patients at risk for exaggerated or subtherapeutic response, apply pharmacokinetic principles to determine patient-specific drug or patient-specific dosing, order and interpret relevant tests at correct time intervals to assess dosage adjustment. Like for example, the plasma drug concentration, blood glucose levels, blood pressure measurements, those are functions on dosage adjustment of clinical pharmacists. Another is selection of therapeutic alternatives. So the use of drug information resources effectively, review and critique drug literature, construct comparative analysis to support therapeutic decisions, and preventive services. Preventive services includes immunizations, screenings, health and wellness education. These are all specific functions or specific clinical pharmacy functions and services. And even managerial skills, planning, implementing on the pharmaceutical care activities within a variety of practice environments, and resource allocation. That's the role or functions of a clinical pharmacist. So before I end my lecture, I have this saying: professionalism isn't just the job you do, it's how you do the job. Thank you for listening.